Hi everyone, this is Fibro Elimination TV, Season 1, Episode 3. You're here today with myself, Dr. Amun, and Dr. Amsu. So we're going to kick off with a couple of questions today, which I will be firing to Dr. Amsu, and he would answer. Okay, so Dr. Amsu, how many different types of fibroids could women expect to suffer by?
I mean, there's 4 different types of fibroids. Not that, each woman will expect to suffer from all 4. There's 4 different types of fibroids. You have subserosal fibroids, which is outside of the uterine wall. This basically is pain. The symptoms associated with this is a lot of pain.
Right.
It's less bleeding, but a lot of pain, pelvic pain, cramps, that kind of stuff. Then we have submucosal, which is inside the uterine lining, which is, excessive, heavy, very heavy bleeding. It can block the fallopian tubes and, cause infertility.
Okay.
But, the pain is less pain.
So with this particular type, there will be more bleeding, but
more bleeding,
but no
very,
pain.
very heavy bleeding, but less pain and possible chance of infertility, and also, anemia if it's chronic.
Down to the amount of blood loss.
Amount of blood loss and, fatigue, anemia, that kind of stuff. Then we have intramural fibroids, which is on the walls of the uterine walls.
Gotcha.
Not outside, but actually on the uterine walls. These are the most common type of fibroids, and these ones are these are the ones what you don't really want to have, because this one is very heavy bleeding, the pain, the cramps, also it's basically, this is the one where women look like they're pregnant.
Okay, so they have the pouch.
They have the pouch,
More than the pouch, right.
So it's your look, it's the way you're feeling, you're in pain, you're in cramps, you're bleeding excessively, not as heavy as the submucosal, but, these are the most common, and, it's the most symptomatic.
And that one is called again?
Intramural.
Okay, so
fibroids.
With the fibro elimination 60-day
There's
challenge.
one more though. There's one more.
Oh, one more. Okay.
Wait for it. Wait for it.
Give them. Sorry.
There's the pedunculated fibroids. These are basically where there's a stalk.
Right.
And the fibroid hangs from the stalk, which causes pain. So if you have submucosal, which is not associated with pain but heavy bleeding, if you have a pedunculated submucosal, the pain is when the fibroid grows and it twists on the stalk.
Ooh.
That don't sound right. We can associate with certain things that hang if it twists. And that's not a good look.
Wow.
But we're not in a position to even say how painful that must be for a woman, because obviously we're not females. But the pedunculated can be submucosal or subserosal, so outside the wall, outside the uterine walls, if it's subserosal. Now this in a pedunculated fashion can cause issues on other organs. In fact, anything that's subserosal that grows large can put pressure on other organs and cause other complications, especially if it's on the liver or on the kidneys or the gallbladder, or the spleen or the
because
pancreas.
the fact that
they're all
combined
closely
next to
knit,
it. Right. So with the 60-day fibro elimination challenge, we can we can what's the word I'm looking for? I would say we can
well, we basically address all of those.
All of those. Right.
I mean, no matter where it is, but this is the thing, is that each female is affected differently. There's estrogen dominance, and it's like, why is it that some of a lot of our patients ask, why is it that I basically got the same lifestyle as my friend over here, and we eat the same, we basically lead the same kind of lifestyle, but her fibroids are subserosal, mine are submucosal, Why is there a difference? You know, we're doing basically the same stuff.
Well, let's go even one step. Let's
Right.
say not friend. Let's say a household full of females.
A household full of females who
And-
live the same lifestyle, they're eating the same dinners.
And one of them out of 4 sisters suffer with fibroids. The other 3 don't.
Right.
What could be possibly the like medical explanation for that?
Well, what it is that each individual has, you know, has their own electromagnetic signature. They have their own electromagnetic makeup.
A bit like a birthmark.
That's exactly what it is. It's a
Okay.
birthmark. It's a birth. Basically, this is your default. This is your default setting.
Right.
And it's all to do with the electromagnetic fields that surrounds us and surrounds this planet and surrounds each other planet and the sun, how they all interact electromagnetically, gravitationally, and you know, each of us through our date, place and time of birth, we have different electromagnetic signatures, and these electromagnetic signatures affect all the 12 systems of our bodies in various ways, you know, and each individual now, because of that, they have different ways how they react to the same environment and to the same diet. There'll be different reactions. Even though there's estrogen dominance, some will have fibroids, and then them fibroids are into those 4 categories, or a combination of those 4 categories.
Right.
Then you have those who have endometriosis, those who have cysts, those who have a combination, cysts and fibroids, then those who suffer from, you know, yeast infections. And it's all to do with, well, why is it that, you know, each of these individuals suffer differently from estrogen dominance is down to their electromagnetic intrinsic weaknesses or strengths.
Got you. That's what I was about to say. So some females will find that they maybe have a stronger resistance to the estrogen dominance, to where other is weaker, so they will possibly suffer
and
more.
also
or
where
quicker.
the estrogen dominance is going to affect. You know, not that some will be stronger. What it is that, all right, some women suffer from estrogen dominance, and because of their intrinsic weaknesses, they have breast cancer or uterine cancer,
Right.
or brain cancer, or some kind of disorder through the estrogen dominance.
Right.
You know, but the estrogen dominance is estrogen dominance. It's just a different name is given and a different condition is given for the same illness, but in a
Right.
different part of the body.
So with saying that, I believe, you know, AMA, we have a mechanism to how to basically let someone know by having the day, the time and the place of the birth, what the strengths and weaknesses are with that electrical magnetic signature that you were speaking about. Right? Can we go into more about that and where people could maybe, you know, sign up to get that done, like a consultation of some sort?
Why? Certainly. It'd be my pleasure to give you that information. Okay, so the system that we use, or that's been utilized over, you know, for thousands and thousands of years, is a system called cosmobiology. Now, it's nothing spooky. This is all to do with electromagnetic fields, L fields, which, you know, I know you have something on that, you know, and how they all interact and how they affect our behavior and our biology, our physiology and our psychology, you know. So this cosmobiology, your date, place and time of birth is going to give you an electromagnetic signature. It's going to determine all your strengths, all your weaknesses.
So let me just get this clear
Right.
for the audience, that we're basically saying that our body, our 12 systems, has a frequency,
Yes.
an electrical magnetic field, right?
Yes.
That is symbolic or in sync, or should be in sync with the universe,
Right.
right?
And those 12 signs of the zodiac, those are basically symbolisms of the sun's phases, you know, or the earth's phases as it goes around the sun in 1 year. The
Right.
sun has different electromagnetic emissions
That's right.
as we move around it, and those are signified by the 12 signs of the zodiac, and it affects us physiologically and psychologically. That's why everyone's into the zodiac, everyone's into their horoscopes, and everything, because, oh, if you're a Cancer, then you're more emotional. If you are such and such, then you're more this way. That's basically a very watered down science to what's actually going on. There's so many interplays between the actual planets and the sun and their effect on the earth. So there's ways in which there's certain planets within each house or within each system, and how that, when they're aspecting to each other at the time of birth, determines what kind of illnesses you can possibly get during your life. What kind of conditions.
How accurate is this information that we're taking from obtaining this information from a patient?
It's the most accurate system in the world for diagnosis. It's the most accurate. This is the universal order. This is why we call it cosmobiology. Is cosmo means order, and then biology. So it's the biological order of each individual down to when they were born, where and at what time. And it's the most accurate.
I would just like to read a little paragraph to piggyback of what Dr. Amsu is saying. It's from Dr. Harold Saxon Blair, and he studied the electrical patterns of life for over 40 years. And it's a book called The Blueprint of Immortality that I'm basically reading from. And
little free plug there.
Right, and it basically just backs up. It just backs, and it says, the universe in which we find ourselves and from which we cannot be separated in a place of law and order. It is not an accident nor chaos. It is organized and maintained by an electrical dynamic field capable of determining the position and movement of all charged particles. So basically what this is explaining is that all our movement, all our frequency is in an organized fashion to the solar system or the earth that we're on. And what I would like to say as a prime example is that when you find yourself out of this electrical current or frequency is when you find people going crazy, committing suicide, killing, raping, murdering, etc. That's when they are out of frequency. Dysfunctional. Now what causes that is an emotional breakdown. And emotional is a buildup of a chemical reaction, which you're going to obtain from your food. This is what our ancient ancestors was teaching, that the food was medicine. You can have herbs that can enhance or make you get to a stable health or stability of health. But the food, what you take, the food should be your medicine, and the medicine should be your food. So just to concur with what Dr. Amsu was saying is that the method or the concentration on what we provide through the natal charts, it is going to be accurate. It's going to get down to why, the root cause of your symptoms. There's no use of healing someone, but you don't know what's causing it. You don't know the root cause, because then what happens? The illness or the deficiency reoccurs again, whether it's 2 years, 5 years down the road. So what I would say to everybody, the audience, that check it out, www.amahealth.org and
/consultation
and check it out, because we have numerous of patients that have done this consultation via this method and has been shocked. Like
dumbfounded.
We've never met them. We've never met them. We've never took their blood. We haven't had them under any scans or any machineries. We've just had a consultation over the phone, and the information that we've received from them is just been the day, the time, and the place of the birth. And from those 3 points or that information, we have given them a thorough breakdown on their health.
And I just want to reiterate and emphasize what Dr. Amun just told you. We don't use MRIs. We don't use scans or x-rays. We don't need to do blood work, right? That's 4 things. You know, what was that 3? 3 things. What are the 4 things? Well, it doesn't matter whether it's 3 or 4 things that we don't use. You can be anywhere in the world. Send us your date, place, and time of birth, and within a few minutes we'll be able to see we produce a natal chart. And that natal chart, we can see everything that can possibly go wrong, or all the weaknesses, intrinsic weaknesses within your body, and determine from those intrinsic weaknesses and all the aspecting of the different planets and what systems they affect. We can come out with every single disorder or dysfunction or disease that you can ever suffer from if you don't look after your body, if you feed your body and move it out of homeostasis, which is balance. You know, we can tell you everything that's going on. We can tell you if you are suffering from any reproductive disorders. We can tell you what else is going on in your body to influence what type of outcome or what disease or disorder or, you know, discomfort you're gonna have according to, you know, your estrogen dominance, how it's going to be affected, you know, and what other organs are also being influenced, you know, by something else, you know, because some females suffer from yeast infection. That's with candida as well as estrogen, you know, and where is that candida going to affect the most? So we have a lot of females who come to us about their fibroids, and we tell them something about their left knee or their toes
or their kidneys
or
their
something
heart.
You know, and they're like, yeah, I was told, you know, they're dumbfounded. But the point is that now we can start to give out prescriptions with our herbal supplements to supplement the minerals that are lacking, because it's all to do with mineral distribution and the lack thereof in your body.
That's
Some
right.
parts of your body is getting enough where strength, that's, you know, you're never going to get sick with that part of your body. But there's a deficiency in certain minerals or a lack of distribution. And that's what we have to balance. So we know this is what we call etiological diagnosis, where we're going to the root cause, as opposed to pharmacological or allopathic, where they're just dealing with, well, we'll pigeonhole you with this whole big thing that we categorize everybody into, this whole big group here, that's where they fit in, this group here, that's where they fit in, and here's the treatment for it. So go and this is going to make you feel better, we're going to make you comfortable. You know, we're not dealing with that. We're dealing with finding out the etiology and then removing that etiology, you know,
so it's
secure.
It doesn't reoccur again. So things like high blood pressure, diabetes, sickle cell, obesity, that's a walk in the park for us to cure. That's nothing. And this is the level of expertise that we have in this medical field. So again, the website is www.amahealth.org/consultation. And that's another episode again from myself, Dr. Amun, Dr. Amsu. I hope you've enjoyed. Don't forget to tune in to episode 4. Take care, everyone. Be healthy. Health is wealth. Your food is your medicine, and your medicine should be your food. Take care.
Peace.